When we're trying to figure out if someone has a predisposition to have more epilepsy, when we're trying to figure out if a seizure was provoked or unprovoked, we'll ask certain questions. For example, was someone drinking alcohol and all of a sudden stopped drinking alcohol? Was someone taking benzodiazepines, which is a particular medication with when stopped suddenly, they may have withdrawal seizure? Or were there no provoking factors? Did it happen out of the blue? If a seizure comes out of sleep, that's more likely to suggest possible epilepsy. If someone has had a history of brain injury or head trauma where they've lost consciousness, that can increase the risk of epilepsy. If someone has had an abnormality in gestation, if someone has had injury at birth or infection after birth or an infection at any time, they can be at risk of developing seizures. If someone has had a stroke, if someone has had a brain tumor, they can be at risk for developing continued seizures. 50% of the time, we actually don't know what causes the epilepsy. So we ask these questions to try to figure out if there's risk factors, but even people who may not have a risk factor may still develop epilepsy at some point, and that's why we ask these questions.